Kayla, welcome back to the mother of all talk shows. I'll tell you why I wanted to talk to you in particular was about medical costs in the United States, because I was following the things that you were saying about it. And that's important, of course, if you're in the United States, but it's important also if you're in the United Kingdom, because your system of healthcare is ineluctably crawling across the Atlantic Ocean. So what you're about to talk to us about may very well be the reality here in Britain in the years to come. So welcome back to the show, and just bring viewers up to date with what you've been saying about health costs in the United States, would you?
Absolutely. And as you said before, that this may be slowly creeping across the Atlantic, I'm going to tell you, I don't wish this upon our worst enemy, no matter what. This is absolutely something that the people of Europe and everywhere in the world should absolutely stand against, because the United States, as many know, is one of the world's most wealthiest countries. This is a very developed country, and yet it is the country that spends the highest amount in healthcare costs. Its people are spending the highest amount. The medical industry in the United States has reached 4.1 trillion this year alone, which has only gotten worse due to the COVID-19 pandemic, as we are the country that's also been the worst affected by that. Also, in part due to our medical system and the fact that the pandemic management was privatized under Obama and Trump's administration. And so you have a country of nearly 400 million, where nearly 400 million are spending $12,000 a year per person just on medical costs alone. And so it's absolutely a travesty. Now we're facing a shortage on baby formula. And as you know, this is also going to contribute to a new epidemic within the country, where babies will now need to be hospitalized because they don't have access to food. And so if you think about it, with the reports showing that there's 3 days in a hospital in the United States could cost you about $30,000. So what does this mean for a country of 400 million? This means going into GoFundMe and asking for money. This means trying to raise money within your local community for applying for programs. Millions of people go bankrupt every year in the United States because they don't have access to medical care, a basic necessity of any country, which is something the Europeans have been able to be afforded, but is slowly going to creep into our system, is creeping into yours. And so again, I wouldn't wish this on anybody else. There are millions of people who go without medical care because they cannot afford it. Unnecessary deaths happen every single year in this country because our government chooses to, instead of putting in the medical care for all, which would create a single payer medical system, completely wiping out the private companies that profit off of the illnesses of human beings. Instead of that, they choose to compete with them with the implementation of Obamacare or the Affordable Care Act. So it's absolutely a travesty. It's a very dangerous situation in this country, and it's completely backwards.
Well, we'll come back to the baby formula, because that is another story that intrigues me greatly. But sticking with the money, first of all, I'm glad you pointed it out, because a lot of people will think from the state of affairs in the US, where tens of millions of Americans had no health insurance at all, that the problem is a shortage of money. But as you've just explained, the value of, sounds perverse to use that word, the financial value of the health industry in the United States is $4 trillion. More than $4 trillion. The average spend is therefore $12,000 a head being spent on healthcare. So you are spending more money on health than anybody else and achieving worse outcomes for the ordinary people, for the ordinary Joe and Joanne, worse outcomes for more money. I mean, how does that even stack up?
I think about the Affordable Care Act, and so I get insurance personally through my employer, and my employer does cover part of it, taking out of my taxes from my paychecks every 2 weeks. So yes, we all spend about, even if you are covered by health insurance, You are spending more money than you really should if you were in Europe or in other countries where there is a single payer healthcare system. And the root problem is that it is an extremely profitable system. People will always need access to medical care. This has been something since the beginning of times with apothecaries and witch doctors. People will always need access to medical care. So it's a sustainable industry that's been extremely privatized. And now we have bipartisan, because I don't want us to confuse with the Democrats who are pushing single payer medical care or the Republicans. Both parties in the United States Congress have stocks in private insurance companies and are making it extremely profitable for the rich who have those stocks, who have access to these insurance companies, and the heads of these insurance companies seeking the money out and sucking it out of the American people who have no choice but to sometimes even access medical care. And I will tell you, George, I don't think this is something that is spoken about a lot, but I personally know people who go to doctors that work under the table. They won't charge it through your insurance. They won't even they'll work from their home offices. They'll work from their homes. They have their own medical supplies there, and they'll pay maybe $200 instead of paying a $1,600 root canal, for example. So there's becoming now an even underground industry of medical care because it is just extremely unaffordable. And you can't imagine that this would exist in any other developed or first world country, that there's an underground market to seek medical care, profiting, becoming increasingly profitable as well. And so you have this absolute travesty happening within the country where people are being sucked out of their money for these private insurances, paying for high premiums, or they go towards the Obamacare or Affordable Care Act options where you have horrible health care coverage. There's very little doctors that will accept that type of insurance. And another thing that the Affordable Care Act also covers is Medicaid. So there's often the saying that if you are so poor that you can't afford to pay into healthcare insurance, then you can get Medicaid. But the reality is, for places like New York City, where the minimum wage is $15, if you're working full time and you make $15 an hour, you don't even reach the federal poverty line as a single person. You don't. Even though you're making $30,000 a year when you can't afford anything, and you likely have two jobs, you are not considered poor. Therefore, you cannot access Medicaid. So what do? You get penalized by the government when you file your taxes. And right now we're in tax season time. You get penalized by the government for not having insurance, but you also can't afford insurance. And so these are a lot of the people who are going into the underground medical care system as well, especially for people who don't have access to vision and dental care. Because it's not all one thing, by the way. It's medical is solely for your body. If you need dental, that's a separate type of insurance. If you need vision care, that's a separate type of insurance. It's extremely profitable. It's bipartisan profitability as well. Bipartisan politicians are getting stocks and making money off of the privatization of our healthcare system while Americans are going into bankruptcy. They're begging for money. And, once again, we'll go talk about the baby formula, but we're asking Europe for money for baby formula. You can't imagine that this is a developed country. We often say this is a first world country, or actually a third world country in a Gucci belt.
Kayla, we're out of time, alas. We'll have to come back to the baby food issue perhaps next week, because I think a lot of people on this side of the Atlantic are extremely confused of how the world's leading economy, the most powerful country in the world, can possibly have a situation where there isn't enough baby formula for the declining number of babies that your country is producing. I can't quite understand it myself. Kayla Popochet, thanks for joining us.